Choking. Few facts. Choking is a leading cause of injury and death among children, especially those younger than 4 years of age. The majority of choking related incidents among children are associated with food, coins, toys, etc., as children have common habit of putting things in mouth. Though no official figure is available on incidents of choking or death due to choking in India, it is a condition which is life-threatening and requires prompt intervention to save life. Airway can be obstructed at various points. Mouth and nose blocked from outside, back of throat blocked, windpipe squeezed by strangling or blocked by object inside, pressure round chest prevent movement. Some airway obstructions are suffocation, hanging, strangling, choking. Suffocation generally refers to an obstruction over the mouth and nose, but can also cover drowning or breathing air with heavy fumes or with very little oxygen. Hanging. Although suicidal, hanging by cord or wire can be accidental. Strangling. This may result from accident. A scarf or necktie caught in a machinery could be pulled tight round the neck. Choking occurs when a piece of food or other object become lodged in the throat, partially or completely blocking the upper airway. Causes. Choking can be caused by food or small household items as toys, pins, marbles, coins. Choking hazards. Hard raw vegetable, hot dog, sausages sliced into rounds, whole grapes, hard candy, pretzels, popcorn, chips, marshmallows, spoons of peanut butter, chewing gum. Signs of choking. Person clutch at his throat is universal sign for choking. Person have a frightened look. Coughs forcefully, breathes loudly, not able to speak, have skin, lips and nails turn blue. Lose consciousness. First aid. A person may be able to cup up the object on their own. Step 2. Give 5 back slaps. Make person bend forward and give 5 sharp slaps between the shoulder blades. Third step. Give 5 abdominal thrust. Make a fist and place it over the lower breastbone. Hold the fist with your hand. Pull sharply inward for 5 times at a rate of 1 every 3 seconds. Choking adult or child. Cuff 5 back slaps, 5 abdominal thrust, again 5 back slaps, again 5 abdominal thrust. Abdominal thrust. Heimlich maneuver. Have a person stand and support from behind. Clench a fist and put it right under the breastbone. Grasp the fist firmly with your other hand. Give 5 inward and slightly upwards thrust. Cover your fist with your other hand and thrust up and in with sufficient force to lift the victim off his feet. If they are still choking, repeat step 2 and 3, back blow and abdominal thrust up to 3 times, or until you have dislodged what's in there and they can breathe again. Step 4. Call for help. If they are still choking after you have repeated these steps 3 times, call 102 for an ambulance. Once you have called an ambulance, continue step 2 and 3, back blows and chest thrust, until what's in there has cleared, help arrives, or they become unconscious. If they lose consciousness at any stage, open their airway and check their breathing. If they are not breathing, start CPR to try to release whatever stuck in there. Continue CPR. Remember to check oral cavity in between. Choking babies. Signs. Baby may be choking if they suddenly become distressed, have noisy breathing, if they are unable to cry or cough. In some cases, they may not be able to make any noise or breathe. For first aid, step 1. Sit down and lay them face down along your thigh, supporting their head. Supporting the baby's head, give up to 5 sharp blows between their shoulder blades with the heel of your hand. Step 2. Then check their mouth to see if there is anything in there. If there is, and if you can, pick the object out carefully with your fingertips. Take care not to push it further in. Step 3. If the back blow fails to clear the blockage, give up to 5 chest thrusts with the baby laid face up along the length of your thigh. Put 2 fingers just below the level of their nipples and push inward and downward towards the baby's head up to 5 times. Check their mouth and carefully pick the object out. If they are still choking, repeat back blows and chest thrust up to 3 times, or until you have dislodged what's in there and they can breathe again. 5 back slaps, 5 chest thrust. Again 5 back slaps, 5 chest thrust. 5 back slaps, 5 chest thrust. Step 4. If they are still choking after you have repeated these steps 3 times, call 102 for an ambulance. Once you have called an ambulance, continue step 2 and 3, that is back blows and chest thrust, until what's in there has cleared, help arrives, or they become unconscious. If they lose consciousness at any stage, open their airway and check their breathing. If they are not breathing, start CPR to try to release whatever is stuck in there. Continue CPR. Remember to check oral cavity in between. Choking pregnant women and obese person. First aid. To clear the airway of a pregnant woman or obese person, position your hands a little bit higher than with a small normal HEIMLICH maneuver at the base of the breastbone, just above the joining of lowest rib. Proceed as with the HEIMLICH maneuver, pressing hard into the chest with a quick thrust. Repeat until the food or the blockage is dislodged or person becomes unconscious. Prevention tips. Chew food thoroughly. Don't force yourself to swallow big chunks of food. Don't eat fast. Avoid talking and laughing while eating. Keep small toys away from children. Frequently asked questions. Is it safe to attempt removal of lodged item using fingers in first place? No. Never attempt to remove or dislodge the impacted item using fingers, as it may further go down and cause the complete obstruction. Check oral cavity for dislodged item after back blows and remove if you are confident enough to not push it down